Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Barium Swallow. Introduction. A barium swallow is a diagnostic test that uses X-rays and a thick and chalky liquid that you swallow. This liquid helps healthcare providers view your esophagus. Your healthcare provider may recommend a barium swallow to help diagnose a problem with your esophagus. This program explains barium swallows. It talks about how to prepare for the test and what to expect during and after the procedure. It also explains the side effects and allergy risks of a barium swallow. The esophagus. The esophagus is part of the digestive tract. The digestive tract is made up of organs that the foods we eat and the liquids we drink pass through. The esophagus is the tube that takes food and liquids from the mouth to the stomach. The esophagus is located in the chest. It is about 10 inches long. The esophagus lies behind the heart and windpipe. The windpipe is also called the trachea. It carries oxygen to the lungs and exhales carbon dioxide. Barium swallow. A barium swallow is a diagnostic test that uses X-rays and a thick and chalky liquid that you swallow. It helps healthcare providers see your esophagus. A barium swallow is done to help your healthcare provider determine if there is a problem with your esophagus. A barium swallow can show many different disorders of the esophagus, including gastroesophageal reflux disease, or GERD, hiatal hernia, polyps or tumors, which are abnormal growths, signs of cancer in the esophagus, ulcers or breaks in the lining of the esophagus. A thin layer of barium coats the esophagus when the liquid is swallowed. This makes the esophagus easier to see in X-ray images. Sometimes the barium swallow test is used with a pill that produces gas. This helps to take better images of the inside of the body. You should tell your healthcare provider if you are pregnant or if you think you may be pregnant. Women who are pregnant should not be around X-rays. Tell your healthcare provider if you have diabetes or any allergies. These can cause complications with a barium swallow. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Preparing for the procedure. Your healthcare provider will give you specific instructions about what you can or cannot drink or eat before the test. This usually depends on your age. Adults should not eat solid foods for 4 hours before the test, but it is okay to drink clear liquids up until 2 hours before the barium swallow. Children under 12 should not eat solid foods for 6 hours before the barium swallow test, but clear liquids are okay until 2 hours before the procedure. Babies under 2 years of age should not eat or drink for 4 hours before the barium swallow test. The procedure. A barium swallow usually takes about 30 minutes. In rare cases, a barium swallow can take up to an hour. Patients usually go home after the procedure. You will wear a hospital gown during the test. Your healthcare provider will ask you to take off any jewelry, piercings, or other objects that may interfere with your X-ray. You will receive a form that asks for your permission to do the test. This is called informed consent. Read it and sign it if you understand and agree with it. You may be strapped to a table that can tilt up and down for your X-ray. Your healthcare provider also may ask you to sit up or stand. During the procedure, you will drink 1 or 2 cups of barium. Barium is a chalky and thick liquid. It is about as thick as a milkshake. The liquid coats your esophagus and helps it show up on an X-ray. Many people do not like the taste of barium. Sometimes the barium solution may be flavored. You will drink the barium mixture as your healthcare provider takes x-rays of your esophagus. You may be asked to hold your breath for an x-ray. You may be asked to take a small barium pill along with the barium swallow. The pill produces gas in your esophagus. It can help your healthcare provider see different structures inside of your body. The barium pill might cause a fizzing or bubbly feeling in your throat and stomach. Try not to burp during the procedure. Risks and complications. A barium swallow is safe, but there are possible risks and complications. These are rare, but you need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. A barium swallow may cause constipation. This means it can be hard to pass stool or feces. Your stool may have a white and chalky color for a few days after your barium swallow, but this is normal. It will return to normal on its own. Some people may have an allergic reaction to barium. This is rare. Talk to your healthcare provider before your barium swallow about any allergies you may have. After the procedure, you will be able to eat and drink normally after your barium swallow. Drink a lot of water to help clear the barium from your body. Drinking a lot of water and eating a diet that is high in fiber can help prevent constipation after barium swallow. High-fiber foods include fruits, vegetables, and whole grains. The results of the test may not be available for 1 to 2 days. Make sure to check with your healthcare provider about when and how you will receive your results. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. The esophagus is the tube that takes food to the stomach. There are many problems that can affect the esophagus, such as painful swallowing. Your healthcare provider may recommend a barium swallow if there is a problem with your esophagus. A barium swallow is a test that uses x-rays and a thick and chalky liquid that you swallow. This test produces better images of your esophagus than x-rays alone. If you are pregnant or think you may be pregnant, tell your healthcare provider. This test is not recommended for pregnant women. During a barium swallow, you will drink 1 to 2 cups of barium. Barium is a chalky and thick liquid. The liquid coats your esophagus and helps it show up on an x-ray. A barium swallow usually takes about 30 minutes to complete, but the results of the test may not be available for 1 to 2 days. A barium swallow is safe. Make sure to tell your healthcare provider about any allergies you have. It is normal to have white-colored stool and constipation after this test. Make sure to drink a lot of water and eat vegetables and fruits for 2 days after this test. Thank you for using Explain.